In this video, we are going to look at how to evaluate and treat nightmares. This is part 2 in our series on nightmare disorder. If you've ever had a nightmare, you know how disturbing they can be. Sometimes they just stay with you all day long. And if they happen for you on a regular basis, or if they happen for your patients on a regular basis, it's a good idea to know how to evaluate and treat them. If you're interested in learning about sleep and mental health, then go ahead and subscribe to my channel so you can keep on learning and you can join our YouTube community. I'm Dr. Nishi Bhopal. I'm a physician specializing in integrative psychiatry and sleep medicine. This channel is all about holistic science-based strategies to optimize sleep and mental well-being. Every video also contains a tip for healthcare providers and is eligible for CME credits. And for physicians, I have a free clinical sleep mini course that is jam-packed with useful tools you can use in your clinical practice. So you can go ahead and sign up for the free course and get free CME, IntraBalance.com/doctors. This video is part 2 in a 4-part series on parasomnias. Nightmare disorder is considered a parasomnia. And if you didn't already see it, go ahead and check out video number 1 in this series on part 1 for nightmare disorder. In this video, we're looking at the evaluation and treatment of nightmare disorder, including some conventional and integrative holistic treatments. What's the big deal about nightmares anyway? Why do we need to be evaluating and treating them? Nightmare disorder can have a real significant impact on quality of life. It can result in sleep avoidance or a fear of going to sleep because the nightmares are so disturbing, which can then result in sleep deprivation, or the continual disturbance of sleep by nightmares can cause sleep deprivation, which actually then makes the nightmares worse. This can all lead to issues with daytime fatigue and sleepiness. It can also make symptoms of anxiety and depression worse. It also can worsen symptoms of PTSD. And then it becomes a vicious cycle where you're having nightmares and then you can't sleep, and then you're afraid to sleep, and then you're more sleep deprived, and then your symptoms during the day get worse as well. That's why it's so important to understand how to manage this condition. How do you even make a diagnosis of nightmare disorder? Well, you need all of the following features. You need recurrent dreams that are well remembered and usually very distressing and typically involve themes of physical danger or a threat to security or survival or a threat to your physical integrity. When the person wakes up from the nightmare, they rapidly become alert and oriented to their surroundings. And then the third feature is that the dreams themselves or the disturbance in sleep caused by these nightmares actually causes significant impairment in various areas of a person's functioning. For example, it may impair their levels of daytime alertness. They may feel really sleepy and find it hard to function. It could have very significant impacts on their mood. It might cause fear of going to sleep or sleep avoidance, or it may impact them negatively in other areas of their life, like at work or at school or in relationships. How do you evaluate nightmare disorder? Well, this is a clinical diagnosis, meaning you don't need any specific testing to make the diagnosis. It's more based on the interview and conversation with the patient. However, if you are looking for an underlying cause, like for example, sleep apnea, then in such cases, it would be a good idea to do a sleep study to see if there's something else that might be contributing to or even exacerbating the symptoms. And there are basically 8 items of information that you want to get when you are evaluating someone for nightmare disorder. Number 1 is a description of the nightmares and how often they happen. Number 2 is how much sleep the person is getting. Number 3 is the person's sleep schedule and how consistent their sleep schedule is. Number 4 is if they're having any abnormal movements or vocalizations during the dreams, which might point you in the direction of another condition like REM behavior disorder. Number 5 is any history of trauma. Number 6 is other contributing factors like medications or drugs or other recent events. And you can see part 1 in this video on different medications that can contribute to nightmare disorder. Number 7 is to evaluate for any other medical issues or mental health challenges. And number 8, you want to fully understand how these nightmares are affecting the person's daytime functioning and their sleep quality. If this type of information is helpful for you, go ahead and click the like button. Now let's look at how to treat nightmare disorder. Now, sometimes these nightmares actually resolve over time and don't necessarily require any specific treatments. But if you are treating them, then you want to start with a top-down approach, meaning you want to start with lifestyle and any specific causes that may be contributing to it, and then you can go into more detail about specific treatments. And so let's look at how to do that. As far as the lifestyle piece, a few things you want to focus on. One is a person's emotional well-being. Are they feeling connected with others? Are they feeling isolated? Do they have a good support network? What are their day-to-day routines like? Are they getting exercise? Are they on a consistent sleep schedule? Are they eating nourishing food? Are they eating food at the right times? What do they do to relax? What do they do to have fun and bring a sense of purpose and meaning and enjoyment into their lives? After you've helped address the lifestyle pieces, then you want to remove any causative factors, like certain medications that might be contributing. And again, you can go back to see part 1 in this series for a list of various medications that could be exacerbating the symptoms. Next, you want to treat any conditions that are associated with nightmare disorder, like PTSD or anxiety and depression, and these treatments may be specific to the condition. They may involve things like psychotherapy or even medications. And then after you've addressed all of these pieces from the top down, you can get into more specific treatments for nightmare disorder, and let's look at a few of those. There is a type of psychotherapy that is focused on nightmares called IRT, or Image Rehearsal Therapy. And this involves rescripting the nightmare, especially if it's a recurring dream, to change the ending and change your experience of it. And it also involves element of CBT, or cognitive behavioral therapy. So how this works is it usually involves writing out the nightmares and then changing the theme of the nightmares. And then once you have this re-scripted nightmare, you actually rehearse it for about 10 to 20 minutes in the evening before bed for about a week. And this type of therapy is especially effective for PTSD-associated nightmares. And if you're working with a therapist on this, it usually involves about 6 sessions of IRT, or image rehearsal therapy. This type of therapy always reminds me of the Harry Potter scene where they are doing the ridiculous spell. If you are familiar with or remember that scene, in one of the characters, Neville Longbottom, conjured up his boggart, which is the thing that people are really afraid of. And his boggart was Professor Snape. And when he did the spell, it showed Professor Snape dressed up like his grandmother. And so it took the fear out of it, and it made it actually quite funny. And so you can actually re-script your nightmares in this way to make them less disturbing and less frightening. And this is actually a very effective technique. The next type of therapy that can be really helpful is CBTi, which is cognitive behavioral therapy for insomnia. So if you haven't already seen it, I do have a video on that where I explain what it is and how it works. There are a number of other psychotherapy type techniques. This is not a comprehensive list, but we'll go over a few that can be useful for nightmares. One is hypnosis. There are some small studies showing that hypnosis can be really useful for trauma and non-trauma related nightmares. The next is ERRT, which is exposure, relaxation, and rescripting therapy. This is really similar to the IRT technique that I just spoke about, but it also involves elements of progressive muscle relaxation in addition to pieces of IRT and CBT. The next is PDMR, which is progressive deep muscle relaxation. And this one may be more effective for idiopathic nightmares, or the non-trauma related ones. And essentially what it involves is learning how to relax and reduce stress while you're being exposed to the fearful situation. And then another technique is lucid dreaming. This is an ancient technique that dates back to the ancient Greeks, where they used to have dream temples. And even in Buddhism, Tibetan Buddhists have something called dream yoga, which involves lucid dreaming. And then in modern science, this was starting to be studied in the 1970s. Lucid dreaming is thought to be a hybrid state of consciousness, which you can measure on an EEG. During a lucid dream, the person is actually aware that they're dreaming. So when you're doing lucid dreaming for nightmares, it is actually like a form of IRT, or image rehearsal therapy, but you're actually changing and re-scripting the nightmare while you're in the dream. Now, as far as some other integrative or holistic treatments, there may be some herbs that could be helpful. One of these is chamomile, which has been used for centuries as a traditional remedy for anxiety and nightmares. One of the compounds in chamomile is something called apigenin, which is a flavonoid found in fruits, vegetables, and herbs. And it's thought to interact with GABA receptors. At least in vitro studies have started to show this. Chamomile is typically used in tea form and should be avoided for anyone who has allergies to ragweed. And under investigation, another treatment is a prescription smartwatch actually called Nightware. Here is your tip for physicians. In some cases, medications may be considered for supporting patients with nightmare disorder. One of these is prazosin, which is considered first line if medication is indicated. There's data supporting its use in PTSD, but less so for idiopathic nightmares. It's thought to reduce hyperarousal by blunting the norepinephrine response, and it can take up to about 8 weeks to work. There's limited data on other drugs for nightmare disorder like trazodone, gabapentin, clonidine, topiramate, terazosin, and then atypicals like olanzapine and risperidone. Now, do you remember the patient that I mentioned in video 1? The young woman who came to sleep clinic with distressing dreams and nightmares with no identifiable cause. What did we do to help her? First thing we did was, she had seen so many practitioners, and we wanted to really make sure there wasn't some underlying cause contributing to her nightmares. So we did an extensive workup, including a sleep study, which was negative. There were no signs of sleep disordered breathing or periodic limb movements or other issues that were disturbing her sleep. She also wasn't on any medications, and there was no history of trauma that would have been contributing to her symptoms. So then the next thing we did was we worked on her sleep schedule, we worked on her circadian management, and we also really worked on relaxation and provided a lot of reassurance. She also ended up working with a therapist for IRT, or image rehearsal therapy, which was incredibly effective, and her nightmares resolved. What was your biggest takeaway from this video? Let me know in the comments.